Thanks so much for joining us. I'm Jennifer Franco. As each day brings us one step closer to the light at the end of the tunnel, questions remain as to what the coming months might look like and what treatments and solutions could expedite America's post-pandemic comeback. One America's Jenn Pellegrino has more.
And we're here with Dr. Jonathan Baugh. Dr. John, thank you so much for joining us again.
Yeah, thanks for having me back, Jen. I appreciate it.
Dr. John, you've got a couple of devices behind you. I understand with your company, Remote Health Solutions, that's what they're related to. Could you give us a little bit of background?
Yeah, sure. Thanks for letting me sort of introduce that. Classically, so Remote Health Solutions, we deal on both sides of telemedicine with devices and support. So we provide providers, physicians and nurse practitioners and such, to be able to take care of patients. But a big emphasis of us has to do with the devices that we sell and distribute. And what makes us unique is our capabilities. We took from the ground up the opportunity to have a unique tablet and add in what we call peripherals: blood pressure, oxygen saturation, 3 and 12 lead EKG, spirometry, all the tools that I would use in real life, a stethoscope, everything to be able to examine a patient other than being able to touch them with my hands is what we can now do over one of our devices.
And with the coronavirus, is this something that we could potentially see at, say, testing sites?
Yeah, so that's actually what we've done already, and we'd like to see it more widespread. I think that we were the first company in the nation to be able to send a person under investigation home with one of our remote patient monitoring devices. In fact, it was a physician friend of mine, and what he said specifically was having that device with him, even though he was a provider, to send that device home with him gave him a lot of reassurance.
And on that note, as we go forward here, the treatments that are becoming available are going to be, all eyes are going to be on those in terms of what's working and what's not. What we're hearing the most about right now is the hydroxychloroquine. We're hearing about remdesivir as well as the convalescent plasma treatments. Could you touch on each one of those and give some background and what your thoughts are on the potential for each of them?
Yeah, I'll sort of preface by saying all three of those are sort of the leading treatments right now, and they're all in studies. They're all in trials in different stages for each of them. And so we're going to see some more data that comes out over the coming weeks. Remdesivir as an antiviral, I think it has some potential. We are starting to see maybe that it has some selective potential here for COVID-19, but once again, it's going to take some more time. As far as convalescent plasma, once again, I think that is great. I believe that being able to introduce in those natural antibodies from others who have already gone through the disease process and built up antibodies into their system, taking and sharing those antibodies, I think that is a worthwhile endeavor to be able to follow. Now, the hydroxychloroquine, that's the one that gets the most press, the most news. And the nice thing about that actually is the fact that it has the most history too. Hydroxychloroquine has been around for 70 years. It's used extensively in rheumatoid arthritis and lupus and diseases like that. We know its side effects. I think right now the recommendation still is to be able to use hydroxychloroquine in those patients who it seems beneficial for, and we're going to gain some more data as these trials move forward to be able to determine truly yes or no based upon actual data whether that's effective or not.
Obviously the president wants to get the economy back up and running, wants people back at work. If we're looking at early May potentially for something like that to happen, there are still going to be cases of the coronavirus out there. How do we prevent another increase as we all kind of go back to somewhat of a normal lifestyle?
Yeah, that is a really tricky question because initially we started thinking, well, maybe this wave of COVID-19 is going to go fast, it's going to go across the country, and we're going to see sort of this big mass pandemic, and then we started being able to be successful at flattening the curve, and then we're starting to see that the time frame of these cases is extending out longer and longer. For instance, here in Utah, where I practice medicine, we're thinking that we're going to see our big wave in May. And so as we look at how do we get people back to work, how do we restart our economy, and how do we let people return to sort of a normalcy, That's a great question. That's a tough question, but I think what we do is we continue to practice in moderation the things that have been successful.
Well, Dr. Jonathan Baugh, stay safe out there. We appreciate all that you're doing and look forward to connecting with you in the near future.
Thanks, Jen. I appreciate it.